During the past couple of weeks, Dr. Edwards noticed a disturbing trend at Rainbow Babies throughout the pandemic. As we have talked about, very small number of children have been very sick. Typically only 1 to 2% of children there were testing positive for coronavirus. Doctor is starting to see some changes in that,
which is typical for kids with respiratory viruses.
Well, Dr. Amy Edwards from Rainbow Babies and Children's Hospital was featured during Governor Mike DeWine's daily news conference yesterday, talking about the coronavirus and the multi-symptom inflammatory syndrome in children. So Dr. Amy Edwards, she's been with us all morning. Melissa Reed did a story on her. Now we're using her in the H. She's very popular with us. She does such a fantastic job. It's nice to see that the governor is recognizing that. Doctor, thanks for being with us. I want to start with what you were talking about at the news conference. So part of the article that was sent out by UH was saying that the multi-symptom inflammatory syndrome known as MIS-C, as we were talking about, resembles the Kawasaki disease. That was back in the 60s. So talk and inform us a little bit more about this.
Right. So this syndrome is something that we actually had never seen before. We started hearing rumblings of it back in maybe March, from Italy, from London. We started getting reports, and then lo and behold, here in Northeast Ohio in April, we had a case. We had no idea what it was. These children are presenting with massive amounts of inflammation, problems with their gut, problems with their heart, and with time and research that's been going on at a rather frantic pace for the last 2 months, it seems like what's happening is the children are getting COVID, very mild, sometimes even asymptomatic COVID, and then about 4 to 6 weeks later, their immune system just goes a little berserk and just starts creating massive amounts of inflammation. But now that we understand that, there's actually some pretty good treatment protocols that we've already established, and they seem to be working pretty well.
And what are some of those treatments, doctor?
So it's a variety of things, basically mostly focused on cooling off the immune system. We based it a lot on the work that came out of Kawasaki disease, which you mentioned, which is another inflammatory syndrome that children can get, though very rare. And so looking at things like steroids and a thing called IVIG, aspirin to protect the heart, and then sometimes anti-inflammatory like rheumatologic agents like anakinra or tocilizumab, which are very focused anti-inflammatories that help cool off the immune system.
And you talk about the symptoms. So when we go to look for these symptoms with our kids, there's not a huge difference between this syndrome and COVID-19?
So there actually is a huge difference. One, most of the kids with MIS-C don't actually have respiratory symptoms.
Okay.
Their COVID was in the past, and they're already over it. What they actually are mostly presenting with is very high fever lasting for several days, GI symptoms, so stomach ache, trouble eating, diarrhea, vomiting, and then they'll usually have like a rash or red eyes or swollen hands and feet or something like that. That kind of gives it away. And then when we look at their blood work, they have a lot of inflammation, and that's how we find it.
Doctor, other big news this week is the cheap and easy accessible drug dexamethasone. Talk a little bit about that.
Right. So an encouraging study came out. I will point out that it's a single study, so we are looking for replication that showed that if patients who have COVID-19 get dexamethasone, they have better outcomes. It's not a huge surprise given how much inflammation plays a huge role in COVID-19. That the study looked really promising. I think a lot of us would like to see it replicated at least once or twice more, so that we could feel confident that it would work. But a lot of people have already been trying it, even just individually without being part of a study, because it is so cheap and easy.
Right, moving in the right direction, I can see. So Ohio not seeing a huge surge in cases right now when we're hearing about that across the country. What are we doing right? Why is there no surge right now? But then you also, doctor, keep talking about what could happen as early as October in the fall, which is, of course, flu season combined with the possibility of COVID.
Right. So we haven't seen a huge surge, but keep in mind, Ohio's been opening pretty slowly. The governor's been taking it a day, sometimes a week or 2 weeks at a time between steps. Some states were very rapid. If you looked at Georgia, they opened up, I think, with only a day or two between each step. And so I think that's been part of it all along the way. We've been urging mask wearing and hand hygiene. And I think if we want to avoid the fate of some of these other states, we've got to stick with it. We talked about research, and one of the big things that's been coming out in some of the research is the route of transmission. And I know this seems like ages ago that all the doctors were arguing about how is this virus transmitted. Well, it turns out that it's mostly transmitted by droplet, which is fantastic because that's easy to stop. All you have to do is wear a mask.
Right.
There is some transmission with contacts of surfaces, so you still need to be cleaning your high-touch surfaces. But really, if everybody in the state of Ohio wore a mask, we could nip this in the bud in a couple of weeks.
That's a great way to end this interview. All right, Doctor, we appreciate your perspective and always being with us here on Fox 8. Thank you.
Yeah, have a great day.
You too. Thanks, Doctor.